Assalamu alaikum viewers. My name is Dr. Naila Chaudhary and I'm a neuropsychiatrist and practicing Kalma Chowk. Basically, I'm head of a tertiary care unit, Nawaz Sharif Hospital. Psychiatry is my passion and working with all those patients having psychiatric ailments and at the same time neurological. So we cover both the sides. I'm the executive director of Blessings Institute of Mental Health. Basically, ये indoor facility है for 40 patients, 20 females and 20 males. Here we have separate setups for addiction patients, for epileptic patients, for dementia, chronic or resistant schizophrenia and depression. In this Blessings Institute of Mental Health, basically dealing with the outdoor basis and outdoor basis, indoor is concerned at the same time like getting the patient admitted either willfully or by force, which is called crisis intervention. Any patient who is suffering mood disorder, so-called bipolar affective disorder, or side effect of any of abusing drugs like churs or ganja or cocaine or heroin or whatever, brought by the family or by us, or willfully the patient enters in, we get him in the indoor. Period varies from 2 weeks to 4 weeks or sometimes 12 weeks. We give them all the treatments like detoxifying the patient, giving them injectable drugs if needed. At the same time, my visit psychological assessment is all the time available. We have a panel of 6 clinical psychologists. Living in this third world country where like poverty and overpopulation is a bomb. So people come across mental retardation and epilepsy very often because getting intermarriages, all these bring this into that. Because primary care units are not providing the facilities, so ultimate result is epilepsy, uncontrolled, which can lead to physical and mental disabilities. Patients come to us, we keep them in the indoor or outdoor depending on the condition of the patient. And after that they are treated, they are psychoeducated. We teach them that parhez ilaj se behtar hai, whatever we have to do for that. The whole team like the clinical psychologists, the medical assistants, my doctors and me work on that. And end of the day, I think 90% of the people who come follow us what we say, they are always recovered, alhamdulillah. One picture which is really pouring to us is like physical mental disability after epilepsy. And you know, it's a dilemma, like even the tertiary care hospitals which are like billions of dollars in Pakistan, they are unable to manage those patients and somehow they fall to us, referred by our previous patients. So जब मिर्गी जिसको कहा जाता है, जिसमें हाथ पांव टेढ़े होते हैं, physical disability आ रही होती है और mental retardation 80% उनमें होती है. So according to our novel anti-epileptics and neurotonics and enzymes which work on the brain, we do with that and patients are recovered and brought back to their conditions, the normal ones, and that's then they're finally told to start with their families. I'm going to tell you a bit about depression and schizophrenia, especially when patient comes to us from all over Punjab or from all over Pakistan, sometimes from Karachi, Hyderabad as well. They are like ill-treated, mismanaged, misguided, drug-resistant and loads of other things. So we try to teach them, we educate them, we, if required, keep them in the indoor. And we tell them how long the treatment is going to be, the first line, second line, third or the fourth line, the tailor-made medication. We get the desired results and ultimately people go happy. So that's it, because depression and schizophrenia, depression is 100% treatable and manageable and at the same time schizophrenia. So nothing to worry because science is really advanced now. हमारा पूरी दुनिया में एक बीमारी है जिसको डिमेंशिया कहा जाता है, अल्जाइमर्स कहा जाता है और हमारे पंजाब में इसको कहते हैं 17 बतरों में बाबा चला गया या माई चली गई है, which means कि वो भूल गया है या most often अपनी रूटीन को वो भूल जाता है. This disease is not a good picture because if it's not treated well in time, so it's it's a downward, so down the grave. But if it is stopped and diagnosed at an earlier stage by 1 or 2 symptoms like forgetting the toothbrush or wearing the clothes from the toilet coming out, so these are the first indications. Or if somebody having a mood disorder at the age of 60 plus, or blood pressure, or untreated diabetes, then this disease is triggered. If we stop it, we can reverse it a little at an early stage, or if it is an advanced one, then we slow down the process. So dementia is pretty manageable and treatable. I think it's very, very sometimes intricate and complicated, but easy at the same time. You know, if somebody's personality is changing, his behaviors are changing, his looks are changing, or his interaction with his teachers or siblings or parents are changing, then I think it's better time to consult somebody professional, the mental health professional nearby. And if they are pretty sincere, then they know that they either need to go to the psychiatrist or to a psychologist. But we should keep on a watch. If these 3 things are changing, the appearance, the personality, the work, or the relationships, then please, you need to refer the patient or come to us.